Today, I'm going to speak about the outbreak of COVID-19 virus and its impacts on people and animals globally. It's my pleasure to speak about the topic, and in my slide 1, it explains about the outbreak of COVID-19 virus and its impacts, just the heading. And in my slide 2, introduction is given. The assessment has been done on the COVID-19 outbreak. The outbreak has been described and its response mentioned and critiqued. The lessons that have been learned from the response and outbreak itself have been mentioned. Pertinent recommendations have been given to improve the situation. Slide 3, it describes the outbreak. The COVID-19 virus, the COVID-19 pandemic is a global pandemic that is caused by public health issues globally. So, the COVID 19 pandemic is an outbreak of the coronavirus, which is an infectious disease caused by coronavirus 2, SARS CoV 2, that causes acute respiratory illness. It was mentioned by WHO, the World Health Organization, 2023. The first case of the illness was recorded in China in 2019, and there was rapid spread of the illness globally. The COVID-19 pandemic was a global outbreak of the coronavirus 2, diseases that cause severe respiratory illness. The first incidence of the disease, novel coronavirus, was noted in China in December 2019, and the virus spread fast into other parts of the globe. The slide 4 includes a public health emergency of international concern was declared because of the coronavirus by WHO on 30th January 2020, and the illness was called a pandemic on 11th March 2020 by WHO. As per reports, there has been many cases confirmed globally. Moreover, the illness also caused deaths globally across several nations. Animals suffered by becoming ill with the virus, and the socio-economic results of the pandemic. The coronavirus pandemic was categorized as global public concern by WHO and later as pandemic. Globally, deaths were reported as per official reports. Animals were impacted alongside humans as well. Outlining and critiquing the response is shown in the slide 5. One response to the pandemic has been to promote social distancing to prevent the spread of the disease. As we already knew that prevention is better than cure, so many preventive measures were also taken. The rapid spread of the SARS-CoV virus 2 and its harmful impacts on physical health has led governments to different types of public health measures globally, such as stay-at-home orders and physical distancing. As we all experienced it, stay at home and physical distancing. However, the social distancing measures were not feasible for all and caused them uncertainties, especially if they are more vulnerable. Despite their efficiency in limiting the spread of coronavirus, the initiatives have changed the lives of the people majorly and might lead to an apparent disruption of their daily activities and self-regulated behavior and decrease in social connections like loss of social support and reinforcer and perceived control that might lead to a particular mental health problems, particularly in vulnerable people. Hence, the social distancing measures, though effective, had its side effects, as everything has pros and cons, and was not suitable for all. Sorry. And in slide 6, it, it indicates that a global joint effort was declared to deal with the illness by WHO, World Health Organization, a global research and innovation forum for the coronavirus was organized by World Health Organization that was physically attended by more than 300 experts and funders across 48 countries and 150 individuals joined online. The joint efforts were for comprehending the degree of knowledge, recognizing gaps, and working together to fund priority research. The impact on animals was largely ignored, as humans were critically ill and admitted to casualties, so the more importance were given to humans than animals. The topics included in the research were finding the virus origin, natural history, transmission, epidemiological studies, diagnosis, clinical features, and management, infection control and prevention too. And there was many diagnostic tests and researches were done for vaccination and therapeutics, and integrating social sciences and ethical considerations were done. Hence, response was a joint effort by many nations to deal with the virus. An important response to the illness was the administration of vaccines globally. Many organizations, WHO, CEPI, and GAVI, are at the forefront of the COVAX initiative, which is best effort to reach a vast global population, according to ICRC 2021. Other companies like Moderna and Pfizer also introduced vaccines to treat the global population. First, low of risk of animals spreading the disease to people, but vice versa can be common, according to Central Disease Control 2022. Two vaccines have been developed on the messenger ribonucleic acid mRNA by modern mRNA 1273 and Pfizer or BioNTech companies that have the genetic information for synthesizing the stable for prefusion for spike S protein if SARS-CoV-2 in a lipid nanoparticle vector that improves uptake by immune host cells. So, COVAX was another vaccine that was developed to administer. Safety measures were followed when dealing with animals, both domestic and the wild. So, in slide 8, despite I was showing despite joint global efforts, there were disparities in the vaccine administration. Only 25% of the older population of lower income countries had received primary vaccines in lower income countries. So, as I said in my slide 8, despite joint global efforts, there were disparities in the vaccination administration. Only 25% of the older population of lower income countries had received primary vaccinations in lower income countries, the very place with limited healthcare access. So, in the potential negative economic impact of vaccine disparities, only focusing on vaccinating their own populations by countries will lead to global GDP losses of nearly 9.2 trillion and half of the cost faced by high-income countries. However, despite global efforts and goals, there exist vaccine disparities, especially in lower income countries. As my slide 9 explains that a lesson learned was that the process of vaccination distribution needed to be improved to engage with disparities. Research by Tato revealed that the distribution of COVID vaccines had not improved and the inequity of the vaccination was significantly by December 7, 2021. There need to be continued efforts for vaccine deliveries with growing focus on delivering to vaccinate adults and making it a reality by WHO 2022. Another lesson was that a one health perspective was largely avoided equitable access to vaccines between countries by offering vaccines knowledge, and expertise exchange and funding the access to COVID-19 tools and accelerator that is striving to offer equitable access to COVID-19 vaccine, therapeutics, and diagnostic. Thus, it has been observed that the response to COVID was limited primarily due to the vaccine disparities, and there is a need for one health perspective. In my slide 10, another lesson was learned that there were significant failures on the parts of the governments. Widespread failure during the pandemic across multiple levels globally resulted in millions of deaths that were preventable and reversal in the advancements made by several countries towards sustainable development. Current vaccines only offer modest and limited protection and thus reduced transmission needs to be the goal. It has been learned that government had a lack of preparedness that resulted in millions of preventable deaths due to their inadequacy. With vaccines having finite and modest protection duration, reduction duration was there. In slide 11, recommendations. Infection prevention and control is an evidence based and practical approach to prevent harm by avoidable infections among patients and health workers. Important components of it are hand hygiene, injection, surgical site safety, hospital operations during and after emergencies, and antimicrobial prevention. In my slide 12, epidemiology can be understood as studying disease in population and the factors that dictate their presence over time. It is recommended that response to the pandemic is managed with principles of public health and epidemiology. With epidemiology focused on studying health events and controlling health issues, it is recommended that when handling the response to COVID, factors like notions of public health of the location is included. In my slide 13, an important principle of public health is that public health needs to be viewed through a lens of health equity that accounts for systemic social and public health disparities. A similar approach to dealing with COVID is recommended. The ecological setting and the presence of animals is also recommended to be considered. And in my slide 13, One Health is a perspective that identifies that the health of individual is closely associated with the health of animals and the common environment. Because ecological balance must be considered, the pandemic has highlighted the need for having One Health principles in the global management of infectious diseases, particularly to manage zoonotic diseases. So, multiple sector coordination is recommended to formulate the response to pandemic. And in my slide 14, the international health regulations dictate the way that 196 countries and who addresses the global disease and spread and prevent the unwanted health. So at last, I want to conclude by saying that it has been seen that pandemic was a global public health concern. The main response to pandemic were regarding the use of vaccines and following social distancing. So the main important are vaccines and following social distancing. And we must use the protection like wearing masks and prophylactic medications can be used. The main responses to the pandemic were regarding the animals were impacted by COVID-19 as well. There were disparity in vaccine distribution globally, and people were negatively impacted due to social distancing. So, one of the health approach must be recommended, like consideration of social determinants of health, maintaining hygiene to prevent transmission, and accurate reporting to identify gaps may be followed. So, thank you.